If your pet has ever needed a central line, but you have no idea what it is, let me explain it to you real quick. So you can have a couple different types of central lines. This is a 3 lumen. This is also a 3 lumen, and that basically just means how many ports does the central line have. So this one has 3. You can have ones that have 1 port and you can have ones that have 2. It all just depends on what is carried in a hospital or what is needed for the situation. Central lines are really nice for our more critical patients because you can give multiple different medications that are incompatible with each other all at the same line. And this is because they don't connect at all in the central line. This has 3 different tubes and it all connects into one. But inside of this tube right here are 3 smaller tubes that the medications go through. They all exit at different points. Our first one is farthest down here, right there, and then up a little bit farther right there, and then finally is our main port at the ending. Typically in our central lines, we'll leave 1 port open for sampling, and that's going to be our most proximal port, so the one that's closest to the heart. In this one, since it's a 3 lumen, it's going to be our brown port. This is the one that's closest to the heart. It sits at the base of the cranial vena cava. And then we have these other 2 ports, so our white port and our blue port, that we can attach different medications and different fluids to. We also have smaller ones for cats or our small dogs. So when you go to place a central line, there's a bunch of other different things that you're going to be using to help you. You'll be using catheters, a wire, a dilator, but at the end, you're going to end up with your central line in your patient. So when it's in, you're going to be suturing it up on the neck where you first insert your catheter into the jugular vein. And it's going to go all the way down to around the base of the cranial vena cava, so that way we can get central sampling, which is why it's called a central line. And it's really nice because you have 3 different ports most of the time, and your most proximal, so closest to the heart, is going to be your brown port, and there you can get all your blood sampling, while you have other 2 ports, and for those ports generally we attach fluids, blood products, or other drug medications that we need to give pretty immediate. Overall, our central lines are really cool and they're super fun to place, and they are really helpful for our patients, and they can help save a lot of lives.